Next is small intestine 15. So if this was the lower border of T1, okay, I go up to T1 and then I go right above it to the depression there. So I'm between the bottom of C7 and the top of T1. So I'm below the lower border of spinous process of C7. And then I go 2/3 of that distance out. Okay. So if this is 3, I go about 2/3 of that out. Yeah, 2/3 of that distance out, right over here. And this will be my SI 15. So it is, kind of like diagonally above it. Yeah. So Lily mentioned, there is another way to remember this pattern. If you know the the 7 star, it's like a constellation, the Big Dipper. It's not exactly, but the Big Dipper has like a it's almost like a pot or something, right? Like this this square forms like the pot of it, and then you have the handle formed by three other stars. So it does kind of take that configuration. You have 4 stars kind of arranged in a. This looks more like a diamond, but like a container here, and then you have the handle formed by these 3 points. Okay, and then let's do small intestine 16, which is the last point. And for small intestine 16, we're going around to the front side. Okay, so we have to feel for the laryngeal prominence, yeah. Okay, which will be about here. Okay, this is her sternocleidomastoid muscle. Okay, so in front would be stomach 9. Between the two heads would be large intestine 18, and then we're locating this point posterior to the SCM. Okay, maybe a little closer. Okay, level with the laryngeal prominence right here. Okay.
So are all these points kind of like needle sort of kind of angle?
Yeah. Okay. Because well, these points, they can be needled perpendicularly. And small intestine 11 can also be needled perpendicularly. But because these other points are, well, these points are on, technically they're still on the chest area. You can needle like some of these perpendicularly as long as your insertion is, relatively shallow. But you do always have to take a precaution when you're working on the chest not to be needling deep and perpendicular. It actually can be better to needle like transverse on these points, especially if your intention might be to work on like these muscles. Like there's a muscle called the levator scapula that goes down to the top corner of the shoulder blade here. So if your intention was to try to work on that, it might be better to use a more transverse insertion, angling with that muscle.
When you say transverse, you're talking about going down or
diagonal?
This
yeah,
way?
diagonal,
okay.
Like, with the flow of the underlying, musculature. Okay. SI actually. SI12, SI13, all of those you can needle perpendicularly as well because they're all over the bone. SI13, SI12, these lie over the supraspinatus, so it can be good to also angle it this way, with the flow of that muscle. Okay, and then SI16, of course, you want to be very careful with that because you're working on the neck. Okay, so those are the small intestine points. Okay.